What if your DNA held a roadmap to not only living longer, but living sharper, stronger, and more resilient as you age? Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong, an exercise physiologist with a passion for making science simple and life better as we age. My guest is Dr. Kendal Stewart, a neurotologist and genomic expert with more than 40 years of experience helping patients, from children on the autism spectrum to adults seeking peak cognitive performance, optimize their health through functional medicine, targeted nutrition, and genetic insights. Today, we'll explore how your genes influence the way you age, the science of neuroplasticity, and the future of truly personalized functional medicine, all to help you better understand what it means to live, think, and feel your best as you continue aging well. The Aging Well podcast encourages informed decision-making and always consult your physician and scientific literature when making decisions about your health. Well, Dr. Stewart, welcome to the Aging Well podcast. Now, you began your career as a skull-based surgeon, a highly technical and specialized field. What led you from that world into functional and genomic medicine?
Well, essentially, my background was in biochemistry and cell biology, and so I really found out that my forte, besides operating on people, was actually preparing people for surgery and getting them out of the hospital and having them heal much better. And in fact, I'll tell you a funny story. Back when I was in practice, I was called by Blue Cross Blue Shield, and they told me that I actually got my patients typically out of the hospital a day and a half earlier than most doctors after we would do craniotomies, and they wanted to come talk to me about how I did that. And so we got all these people came down to my office, and I remember we sat down, and it was about a 10-minute meeting because when they heard it was nutritional preparation, they really didn't want much to do about it. So
Figures.
I really didn't want to touch it. So, in general, the biggest hurdle, surgery is actually very straightforward. The problem is outcomes can be very dependent on the health of the individual. And in many cases, I was actually taught to actually operate on things and destroy systems, for instance, like cut a nerve, when I didn't really understand why the nerve couldn't just heal itself. And so that became a very lifelong passion of me, trying to create an environment in people that gives them the best chance of resolving their situation without us going down a one-way street of destroying a nerve. And so most of my effort began when I was doing vestibular medicine. So we were doing people with chronic vertigo, and vertigo is very devastating to somebody's life. People with Meniere's disease, everyday vertigo. Every time they move, they feel dizzy. And so I was taught to actually cut those nerves, and didn't sit well with me. So I got very interested in how we could use biomarkers. At that time, it was mostly blood biomarkers to actually identify what was really weak in that person and how we could replace it and get a better chance of recovering it. And after that happened, a lot of people started recovering. So we wound up not having to operate on them. And so the hardest thing in functional medicine, I'm sure you agree the same way in academic medicine, is making sure you have something that's objectively indicated. You want to have, you want to know exactly what you need, exactly what you don't need, and you really want to have something that you can objectively measure to actually prove the principle of what you're after.
So what did you begin noticing in your patients that traditional medicine wasn't addressing effectively? You talked a little bit about recovery time, but what else?
Well, so the big thing that really set me apart, I got very involved in autism secondarily. So I'm a vestibular expert, and in kids with autism, we basically have kids that can't integrate their vestibular system with their visual system because they are fluctuating so much. They're having good days and bad days. And so that actually led us down the path of methylation. And so I've been dealing with methylation, what most people will call MTHFR now. I actually deal with the whole pathway, but I've been dealing with that since 2002. And when I first started dealing and mentioning that to people and teaching it to people, you would have thought I had two heads, because it's now so more prevalent, and accepted. But back then, it just didn't. Nobody paid attention to that kind of thing. So I got very interested in how we were going to assist these children to actually recover from their interruption in their development process. And it turned out that the autism research was not very good at the time. So I wound up stealing essentially academic and um, functional concepts from many other areas of medicine. So I wound up also doing a lot of head injuries. We actually identified at that time that there were actually probably two forms of concussions. We had a cerebral concussion and we had a vestibular concussion. And how that became apparent is we actually noticed that athletes, when they got hit in a certain plane, would actually sway in that plane after the injury. So if they got hit from the side, they would sway side to side if we were doing a Romberg or tandem Romberg. Or if they got hit in the front or at a diagonal, we could actually see that. And I'm sure you know that athletes don't tend to tell the truth about their concussion injuries.
True.
And so I got involved with the University of Texas at Austin, basically first studying the female athletes, and then eventually wound up with the male athletes. And we were able to use objective diagnostic tests for return to play criteria. So, the biggest question you have when you're a physician is not, is there a problem, but it's how you're going to fix the problem. And so getting those athletes returned, getting these kids who were stalled in their development, we really needed to start recognizing some things that were missing as a general rule. And that's kind of what led us down the beginning of what wound up being a 20 to 25 year project for me.
Wow. So, how has your perspective on health evolved from surgical intervention to more functional optimization?
Well, I can tell you I don't operate anymore, and it's not because um, necessarily it's not needed in some situations, but obviously we're much, much better at actually healing people and providing an environment, and we keep getting better and better at it. And, back when I first started, we didn't call it functional medicine because there wasn't such a thing yet, but it turned out that functional medicine really allowed us to understand the biochemistry. And as you may know, many of the physicians really know an algorithm of medicine. They don't really know an algorithm of biochemical pathways and how we can replace what we're missing. And you and I both know that when we have a substrate, or let's say a vitamin, we want to convert to its final form, it will have to go through multiple steps before we can get it to its final form. So we needed to know where the step was, and we needed to know what was going on within the cell. And that's the hardest thing, because measuring blood, although we can find some biomarkers in blood, we really want to know what's going on at the cellular level. And so we've got very involved in biomarkers. And then eventually, when nutrigenomics came out in 2015, it was Christmas for me, because we finally had a way to look at people individually. And so I wound up creating and building a genetic lab called GX Sciences, where I parsed through about 10,000 genes and found about 120 we could use that were nutrigenomic genes that we could use to assess some kind of important concepts in healing. And that just changed everything for us, because we could be more precise in the person that you're sitting in front of. I always like to say that practicing individual medicine, which means if you come to me to get you well, you have to be selfish. We only need to talk about you. We don't care how many other people necessarily got better. We care about how you're going to get better. Whereas when we're doing things like drug studies and other things like that, they're throwing everybody who is genetically different in a big tub, and we're essentially testing a medicine on them and telling us the side effects and how many people it works for. Well, what you care about is, does it work for you? Do you understand? So it's just a different concept, and boy, we have learned so much. We actually have a new genetic company, which we can talk about, that is basically about longevity. I know that's a big interest for you, and we're going to be checking 1.2 million genes in every patient for our database. So,
Wow.
very interesting process. It's a company called Extending Me, and we just launched it earlier this year. So,
Yeah,
it's
our interest is a bit beyond just longevity. I mean, we're looking at really that how do we live younger, longer is that basic
absolutely,
role, you
well, you're
know?
preaching my language. Yes, sir.
Yeah.
And so, in general, we preach the same thing. We don't just talk genetics, but once we have genetic alterations, we replace it with supplementation if that's possible. But we then also got to epigenetically turn the system on. And so we will talk about exercise, we will talk about nutrition, we'll talk about just about every aspect we can to enhance the ability to epigenetically modify that cell to be in a younger cell. So,
If you're enjoying the Aging Well podcast, be sure to like, subscribe, or follow on your favorite platform so you will never miss an episode. And if you find our conversations helpful, please share the podcast with a friend because aging is something we're all doing and we're better at doing it together. And support our guests in this podcast financially by visiting the affiliate links in the episode description below and use the links or codes provided for discounts on products we have vetted and feel comfortable recommending to our valued viewers and listeners. Thank you, and now back to the podcast. So for those that are unfamiliar, how do our genetics influence neuro-immune function and long-term cognitive health?
yeah, so what's really interesting that has really never made sense, and I'll tell you another story because, it's just my memory, but we operated on a young girl back in about 2007, and it struck me really bad because she didn't have any history of trauma. We were actually going in to take out a benign tumor. And I got in there, and her brain was bright red. I mean, it was almost tomato red with inflammation. And that wasn't what we expected. We went ahead and took the tumor out, but that really struck me what in the world was going on with this nervous system. And so I got very interested in inflammation as a causative agent of many of these problems. And as you may remember, because you're around my age, I'm assuming that you know up until about 2015, people didn't really talk about inflammation in the nervous system and microglial activation, which is what we tend to call it. But what happened is, what never made sense is that in the neurotransmitter model of functional neurology or psychiatry, chemicals can't change that fast in the body. They have to take time to change. But we can have somebody go manic in 15 minutes. You know what I mean? And so it never quite met the criteria to us to understand how that was happening from a chemical standpoint. So eventually, they were able to actually label microglia and start doing PET scans. Okay. And the first people they did was actually Alzheimer's patients back in 2015. And what they asked was something very simple: is inflammation and microglial activation. So microglia, are the immune cells of the nervous system. Were those involved in Alzheimer's? And guess what they found in every patient? That inflammation was also involved. And so what happened is I went back actually about a year and a half ago. I was given a lecture and I decided to go back and see how many times that study of that type had been done since that time. And it turned out to be 179 times. And they had done that same PET scan study on ADD, ADHD, bipolar, sleep disorder. I mean, anything you can think of. And it was very, very clear from all those studies that inflammation was involved in a majority of them, and you couldn't separate inflammation and from the brain itself, meaning that inflammation can make rapid changes to the nervous system function. So, with that being said, basically, we had to realize that really controlling inflammation when we're attacking or trying to alter these diseases was probably the first step. Because, if my knee swells up from an injury and I keep walking on it, it stays swollen. it's not going to heal, and nobody's ever missed that question. I ask it to all of my patients. I'm saying, imagine Dr. Stewart, I'm a guy, I hurt my knee, it swells up. The doctor tells me to sit in a chair for 2 weeks. What's the chance I'm going to sit in the chair? Being an ex-athlete, and the answer is none. But if I keep walking on it, then I haven't passed the first step of healing, which is the control of the inflammation. And it turned out to be the same way with the nervous system. So, from a functional standpoint, we essentially know that I used the term neuro-immune syndrome beginning in about 2004, because really most of the problems that we see with the nervous system now is basically inflammation is the cause, but the nervous system is the target. Whether you're dealing with autoimmunity, whether you're dealing with head injury, whether you're dealing with anything that sets the system off. And so genetically, it becomes very clear that people who get into nervous system or neuroimmune problems can't turn off their immune system once it's activated. So we look at genetically, we look at on switches, which are inflammation. But if you're looking at Anglos, that's 80% of them that have a mutation in their aggressive uh, initiation of inflammation. The problem really becomes that if we can't turn it back off, then we get ourselves into a situation where we're not very successful at healing something or resolving it.
So, what are some of the most common genetic variants that you see affecting patients' energy, focus, and aging trajectories?
Yeah, so basically, the immune system is divided into three major parts. We talk about the JAK-STAT system, which is the chemical messenger system. We talk about the tumor necrosis factor system, which is kind of general activity of the immune system. And then we talk about the toll-like receptor system, which responds to infections of different type. And so basically, we see kind of an equal variation in those systems not working quite as well and not being able to control the inflammation. And what I mean by that is people who get into neurological syndromes, their immune system, once it's turned on, they have a lot of trouble controlling it and can't turn it off. And so they continue down the path of symptomatic suffering. Does that make sense? So,
Mm-hmm.
what we have to do first, and it's a process we teach because, I do a lot of lecturing too. And the lecturing is really about how do we impact these people's lives. So we have to turn off that inflammation first. And so we tend to use things that are more natural, more tolerated long term. We don't use a lot of, for instance, a lot of um, medical grade steroids. We don't use that. That's a temporary thing. You can't be on them for a long time. That just doesn't. It's not practical. Now we will use bioidentical steroids. So in men, if their testosterone's low, we will raise their testosterone with a peptide, or we'll raise it even sometimes with testosterone therapy. Women, progesterone helps us a whole lot with that. We use another steroid called vitamin D. Most people don't know that's a steroid, but it's a very effective steroid. We use low dose naltrexone. It turns out the endorphins that people love to make to try to calm their nervous system, the opiate receptor on the immune cell actually upregulates. So if we come in with naltrexone, this very low dose of it, maybe 3 to 4 or 5, 4.5 milligrams, we're able to let them make their endorphins and we don't stir up the immune system. We also have been very active lately in using peptides, in particular one called thymosin alpha 1, which is a bioidentical peptide that your thymus makes when you're younger. And it kind of depletes itself about the age of 35. So when we put that peptide back into you, we get a better balance back to the system of controlling inflammation. So those things that I mentioned are all very safe to take long term and kind of get us past the first step. And then we then go through a process called autophagy, which basically involves insulin resistance in most of this situation. The brain's a very high energy organ. It needs lots of glucose. And so if we get too much debris in the brain, we tend to get insulin resistance very early in the brain before you'll ever get a blood test elevation of your A1C. So we enhance the insulin functionality. We've been using D-chiroinositol, which is a second messenger for insulin. And we've also been using the GLP-1 medicines in microdoses, like tirzepatide in these microdoses to help the insulin resistance. And it seems to help us recover this system very well. We then work on neurotrophic factors. And I'm sure your background is really great in that, because the wonderful thing about exercise is it helps the brain to recover itself because of BDNF and all the other neurotrophic factors that tend to get activated. And I mean, we just go through these steps that we would want to check in order to make sure we've put together the whole puzzle to build a foundation for those people to recover. You know, because what you put in your mouth is important. Don't get me wrong, but whether it's delivered to your cell is just as important.
There's so much to kind of unpack from all that as we, kind of look at aging. You mentioned the thymus, and we can talk about thymus involution and that
Yeah.
role, and just declining immune function, all these things that happen as we age. How much of what we attribute to aging is actually genetic predisposition versus lifestyle and environment? Because you mentioned exercise in there, and we know exercise can do a lot to counter some of these
Well,
declines. We know good nutrition can.
absolutely. I don't think there's any doubt in most people who study this that in environmental effects, meaning bad diet, no exercise, everything is probably the biggest driver of premature aging. The genetic foundation just allows us to alter the things that can really get in our way. Meaning that if I'm going to bake a cake, I want to make sure I have plenty of sugar. I don't want to ever make a cake without enough sugar. So, from a genetic standpoint, I don't think there's a whole lot of things that we can't overcome in making you age healthier. But the cell, especially through the methylation process, has a beautiful ability to shut things off. And I like to say, if you don't have enough money in your bank account, you better adjust your spending or you're going to get into trouble. But every time I've put more money in my bank account, I spend more. And so your cells do the same thing. So if we start delivering this great nutrition, and then we start feeling better and we start exercising, we start eating right and everything, the cell gradually will go through this change where it actually demethylates the DNA and turns these genes back on. And we actually see that in healing. People don't heal in a straight curve. They heal and then they plateau for about 6 to 8 weeks, and then they'll heal again, and then they'll plateau. And I think that plateau is all about epigenetic modulation or turning on genes that you had turned off to preserve yourself. And so I'm a firm believer that living the quality lifestyle that has been outlined, meaning, enough exercise. Now that's a big discussion. What's really enough? Because some people are just not exercise people, but eating a healthy diet, avoiding chemicals, and if you can't get them out of your body, less washing them out. Even simple things like maintaining an alkaline environment in your body can be uh, incredibly modulating to the functionality of the highest energy organ, which is your nervous system. And so uh, we we know for a fact that genetics are not everything, and in fact, it's probably not even the most important. I do think that lifestyle is probably the most important in my mind.
You mentioned epigenetics, and I would say that probably the epigenetics piece connects the two.
Yes, absolutely. And even the transcriptome, and we can get into a lot of technicalities, a lot of sophisticated tests that sometimes we don't know what to do with these days. Uh, they're fascinating things for geeks like me to sit around and think about. But the major function of epigenetics is it actually makes no sense from a practical standpoint that the harder I tear my body down, the healthier it gets. You understand? I mean, you think
Hmm.
about it, like the harder and more aggressive I beat my body up, the healthier my body tends to become. And so it's very hard. It's an enigma in a lot of people's minds. And, and you probably know because it's your field, but, getting back to starting exercise when you haven't been exercising is a tough row to hoe. It's really difficult for people to get back in the flow, and especially ex-athletes. We go in there and act like we were 25 years old again, and we overdo it and can't get to the gym the next day because we're so sore. But in general, it's becoming fairly apparent that we don't need to be ridiculous about the exercise, but we do have to keep the body moving. I'll tell you one other thing that really struck me. I was watching it was a show on the blue zones, and I don't know if you've seen it on National Geographic, but they were looking at these blue zones where people live to be 100, and one of them was in Sardinia. And they went to Sardinia and they found out a bunch of things. They found out that, they eat local grains, even though they eat pasta and things, it was local grains that, weren't modified. They eat lots of vegetables, they grow their own stuff. But the most interesting thing to me was that they were able to correlate, according to each village, the number of centurions was dependent on the steepness of the village uh, in its slope, which means the more that people had to walk up or down to visit their friends and relatives, the longer they tended to live. And I thought that was the most impressive correlation I'd seen in a long time.
That is pretty impressive, and I've not heard that part of the whole blue zone studies. That I mean, I
Right,
know a lot of it is that they're all they're walking up and down hills a lot more, and they're carrying
sure,
things up those hills, so they're actually exercising, but they're really not exercising the way we think of exercising. We're a
correct.
society that's going to hop in our car, drive 5 miles to the gym, and then walk on a
Right.
treadmill up a grade for 5 miles,
Yeah,
and they're just
exactly.
walking everywhere. And
Well, and that's, there's two ways to obviously go about it, but I thought that was really impressive. That impressed me the most about that whole show. I was just very fascinated by that. So obviously in my lifestyle, I emphasize exercise, and at my age, I'm 62, so I really emphasize to my patients once they get about 45 to 50 that functional fitness is probably more appropriate. A lot of mobility, a lot of, not doing max reps or max weight, don't do ultra endurance unless you're really trained for it. So it's just something that biochemically makes a lot of sense, and common sense wise doesn't make a lot of sense. So
yes, you really nailed it about us being about the same age. We're the same age. I'm 62 as
oh,
well.
okay.
So, yeah.
Well, good. Well, hopefully we look good then.
Yeah, we do. We look great. And anybody
Yeah.
listening, we look really, really great. If you're
Yeah.
watching,
Don't. Yeah.
your camera might need to be adjusted a little bit.
Uh,
No, I think we look great. I mean, I think, you know, unfortunately, society kind of sets a low bar for us aging adults, that it's pretty easy to look great. The older you get, the more you're doing the right stuff,
right. Right.
and
That's right.
I tell my students that, if you want to be fit in your old age, just maintain. All you have to do is maintain for that 40, 50, 60 years. And as you're maintaining, everybody else is declining so rapidly that there's this tremendous separation with each, I talk about going back to every reunion. My goal is to go back in proportionally better shape than everybody else, so that by the time I'm 80, everybody will be, remember what a great athlete he was in school? And I was a
Right.
mediocre
Exactly.
athlete. I mean, I was athletic, but not that great. But there'll be all kinds of stories of my great feats because I was so fit when I was young. Um, so when you're talking about genetic testing, when people hear genetic testing, I always often think about disease risk. How does your approach differ when you look at what role does genetic testing play in aging well, aging with good health?
Well, so there's three forms of genetics that people need to know about. Exome sequencing, which is the one they do on people, looks for disease. So if you have a specific gene that's mutated or not functional, you will have a disease process. That is not what we're interested in, meaning those, in the absence of being able to alter those genes with CRISPR or something else, you're just not going to overcome the process. The second is pharmacogenetics, which I'm also kind of an expert in. We are able to look at your liver enzymes, how they break down drugs effectively or ineffectively, and we're able to get an idea of things that could actually put you at risk from a drug. But they also process hormones and other things in the body and have to do with detoxification. And then the third is the one we're really interested in, which is nutrigenomics. And it's basically a scientific method for us to look at a specific nutrient or process and look at the whole pathway, meaning can it be absorbed? Can it be delivered? Can it be converted in the cell? Can it be broken down? And can it be excreted? So, nutrigenomics as a whole, we've kind of modified it to where it actually is a clinical tool that we can use for all aspects. So we look at inflammation control, insulin resistance risk, neurotrophic factors, delivering all the other factors, fats, proteins, cholesterols to the cells. We look at methylation, we look at detoxification. So we're looking at it with right now about 120 genes that give us a good idea of how we can overcome the process. Overall, those 120 genes have just changed the landscape. We really are night and day better at helping people recover than we were even 10 years ago, because we were able to see it, because blood is just not a great biomarker. Now, that doesn't mean we can't make it that way. We have some wonderful new blood biomarkers that just got FDA approved, and we'll be using them next week. We have one that actually can measure concussions and whether your brain got involved. So we look at 4 biomarkers that tell us whether the cerebrum got injured. That's coming out next week. We also have a new one that's been approved where we can look at p-tau, which is a phosphorylated protein that tends to cause Alzheimer's, and we're able to see if somebody is heading toward Alzheimer's, and hopefully we'll be able to interrupt that with things like therapeutic plasma exchange or changes in supplementation, or maybe even changes in exercise and activity. So we basically, we've just at a point where I think everybody's starting to realize that we needed objective indicators of outcome instead of just handing somebody a medicine and asking them if they feel better. So I'm really, even though I'm in private practice, I'm really scientific in my approach. I don't like to function. It's probably my neurosurgical background, meaning that there's one thing a neurosurgeon never does that every other doctor does. Do you know what that is? It's called
No, I don't.
guessing. We don't
Oh,
guess. We don't guess, because you're not going to let me cut your head open on a hunch, So
that's true.
I'm being kind of a smarty, but you know what I mean? It's well, objectivity is always good. Patients want to see it. Once you've educated, they want to see how their test was. And when it's put on paper, it seems to have a lot more validity.
That kind of leads to my next question about, can you share examples of how personalized nutrition or supplementation has transformed outcomes for patients?
Sure. Yeah. So, we do it almost every day in the clinic. So, but if we took like a child with autism, for instance, so if we have a child with nonverbal autism, what's really unique about them is they tend to have good days and bad days. And the problem with that is the brain is able to adjust to just about anything as long as it's a static system, which means that it has a beautiful adaptation. But if we have good days and bad days and we have this fluctuation, the brain never knows what to adjust for, the good day or the bad day. And so in that situation, if we take the inflammation out or control the inflammation very well, we'll see a child who becomes more stable every day. Now, even if we accomplish that, that child will then start to progress again and will be able to develop speech and functionality and socialization. Now, it's not a rapid improvement, but keeping that child consistent is very important. And then we also have to make sure that we're feeding the glucose load to the brain adequately, especially to the sensory organs. So I like to say the retina is the highest energy organ in the body, followed by the cochlear vestibular system, followed by the brain, followed by the endocrine organs, followed by the immune system. And everybody kind of knows that practically. Imagine I set you around a table of 90-year-olds and they have old mitochondria, old batteries. How good are their eyes? Yeah, and how good are their ears? How good is their brain? Do you understand? So it's something we know practically, but when you have to point it out, you just kind of make people understand. And so once we get that accomplished and we're able to deliver glucose, and then we found out most of these kids have neurotrophic factor weaknesses. Their brain-derived neurotrophic factor is mutated. So we actually use a peptide called dihexa, which has worked wonderfully for us in head injury recovery and also in autism, and that raises brain-derived neurotrophic factor between 5 and 7 times, and so we were able to supercharge the healing process. And I'll tell you, we not just an individual case, we have nonverbal kids come back and talk to us 9 to 12 months later, almost, certainly every week here in this clinic. So there's no way for a doctor to heal or give a medicine to cover up a developmental issue. Now, it's the same if you go to the opposite end. Most neurodegenerative, or what I call aging diseases, most of them are when you eventually get that person who dies and you look at their cells under a microscope, their cells are packed full of garbage. So looking at Alzheimer's, looking at Parkinson's, any of those, their cells are packed full of garbage, and it's so packed that the cell just can't function. But a normal cell doesn't have garbage in it. So we were like, what the heck's going on? Where did all this garbage come from? Well, it turned out to be the process known as autophagy that, won the 2016 Nobel Prize. And it's really interesting. The speedometer of all cells is called the mTOR. And what happened is Dr. Osumi was studying Alzheimer's in Japan, and he was growing cultures of Alzheimer's cells. And he noticed the mTOR was running nonstop. So the biggest problem with the nervous system, in my mind, is that when it gets injured or hurt or stressed, it doesn't know how to rest. All it knows how to do is start working harder. And so he took these Alzheimer's cells, added rapamycin, which is a medicine that turns off the speedometer, drove it down to rest. And as soon as he went to rest, the cell took the garbage, stuck it in a pocket, put enzymes in the pocket, and dissolved the garbage away. So that's where he won his Nobel Prize for the ability of cells to clean themselves from the inside when they're at rest. The problem is when nervous system cells get in trouble, they don't know how to rest. All they know how to do is work harder. And so they forget to clean themselves and garbage builds up. And I like to tell my patients, you can't walk through a hoarder's house because there's just no room. And that's pretty much what a lot of the progressive neurological diseases are based on. And so being able to slow the cell down, being able to augment the insulin delivery, being able to alter the cell's comfort points. And I can tell you through the AMP-K system, exercise certainly does that, so it's part of the process. And we certainly are able to certainly slow a lot of those disease processes, and in some cases we're able to actually stall them and reverse to a certain degree.
So many questions that can come from all that, and I don't know where to begin.
Good.
Let's go back to kind of the mitochondria. What's the science say about supporting mitochondrial health and cellular energy as we age?
Yeah, so what I find out from a biochemistry standpoint that people underestimate how many roles the mitochondria plays. So obviously, it plays the role of creating energy called ATP. And the Krebs cycle itself is a marvelous system, also known as the citric acid cycle. And we can actually measure the genetics of the respiratory chain and see if there's weaknesses in that. So we do know people have different strengths in their mitochondria, meaning a super athlete does have healthier mitochondria than a person who fatigues earlier or doesn't recover as fast. But what people forget about too is that we make all of our steroids on the surface of the mitochondria. So all of our steroid conversion is on the mitochondria. And there's a lot more involved at the mitochondrial level. And the problem is that as the biggest problem that we have in a lot of people is that we don't have ability to deal with oxidative stress quite as much. So, the foundation of the mitochondria is it produces oxidative stress, which then produces hydrogen peroxide. And hydrogen peroxide is toxic to the mitochondria. So, from a cellular standpoint, we have three major enzymes that can deal with hydrogen peroxide. We have the catalase system, we have the glutathione peroxidase system, and then we have the Fenton reaction. And I like to say anything that God's got three things there to do, that means it's really important. And so, believe it or not, if you have a weakness in the catalase or a weakness in the glutathione system, you are going to clog your mitochondria up. It's just not going to be as efficient. So being able to alter that and get your batteries back to normal, we can really just do everything better. I mean, everybody's had the experience with the remote at home for the TV, and when you put a new battery in, it works pretty nice. And so there's a lot to be said. We also know now about the cell danger response. I don't know if you know much about that, but it turns out that the nervous system has a built-in system to protect itself in big crisis by actually uncoupling the mitochondria from the cell itself and putting it into a pseudo hibernation state. And so, I mean, really, mitochondrial health is about as important as it comes when you're dealing with nervous system in particular, because it's just such a high energy organ. I know I just created a lot more
So
questions.
how
I'm sorry about that.
Oh, of course. That's okay. That's what we're here for. I love this. How do we then focus on caring for our mitochondria? What steps would you recommend for the listener and the viewer that says, okay, I know now the mitochondria is really important. It's not just that powerhouse in the cell. It's doing a
Yep.
lot more. I got to keep it healthy. What do I do?
Yeah. So first of all, I certainly like to measure the genetics of that and see if the mitochondria is inherently in trouble. So we can find things like CoQ10 is not being made plentiful enough. What do we need to feed it to make it operate at the right level? We certainly also need to know whether it's superoxide dismutase. So SOD2 is involved in the mitochondria. So you can look at that to know whether you're able to clear the oxidative stress out. I love to use PQQ, pyrroloquinoline quinone, which is a supplement that actually stimulates mitochondrial biogenesis. Exercise is hugely important for the same reason. So if you can't strengthen your mitochondria, but you can grow more, you're going to be better off. So, and then obviously from a nutrition standpoint, lots of antioxidants, changing the nutritional environment to the mitochondria, ensuring that you deliver plenty of glucose. And to me, there's five things that are needed for the mitochondria to work well. And the problem is people always assume that if I use one supplement, I'll accomplish it, but that's not the case. We got to have glucose for pyruvate and the Krebs cycle. We've got to have thyroid, okay, to activate the mitochondria. We've got to have a steroid of some type. Okay, we've got to have trace minerals to make it work, and then we've got to have methylfolate or some form of methylation donor or methyl donor to make the Krebs cycle work right. So the way we approach it clinically, which is much different, is not just look at one individual thing. Like when you go to the doctor and they say, "Oh, you're fatigued, you must be your thyroid." Well, you add thyroid and they might feel a little better, but they don't because you missed something else. So really what you want to be is make sure that you're thorough and ensuring that you're checking and providing enough, if not more than enough, of those 5 things to make the mitochondria work at its best.
So it sounds like you're kind of going against the grain of medicine where you're not focused on fixing the symptom, you're focused on finding the source of the problem and actually addressing that. Is that what I'm hearing?
Yep, and that's the foundation of functional medicine. Yes, sir. You are speaking my language.
So simple.
Well, it is. And the problem with medicine, Western medicine in general, is the diagnosis is the most important because that's what you get paid on. You know, my clinic is cash. We don't charge a fortune. You know, we charge very reasonable fees, but I don't care what your diagnosis is. I care that you get better. And that's really what it's about to me. I don't care what we call it. It doesn't matter to me. You know, now we'll call it an appropriate diagnosis, but what we're really interested in, you come to the doctor to get better. You don't come to get diagnosed. You kind of know what you have. So
It always strikes me as kind of funny. We have to put functional in front of medicine. I feel like all medicine should be functional, but it's almost like when we talk about functional medicine, we're then talking about so much of more traditional medicine being really, in a sense, dysfunctional medicine.
correct. Absolutely. You're preaching my language.
So you've worked extensively on neuroplasticity and brain optimization. How
Right.
can older adults actively maintain or improve cognitive function?
Okay. Well, so cognition is a really complex concept. And what I mean by that is it does involve several neurotransmitters. And so, the way I'm going to approach it is that I want to ensure that I've checked the genetics to make sure that I'm producing plenty of the neurotransmitter, be it dopamine, be it norepinephrine, be it epinephrine. So there's different components to it. And what I really mean by that, most people tend to be focused on the dopamine system for most of the cognitive processing, and it's really not true. Dopamine's conversion to epinephrine plays a huge role at short-term memory imprinting and kind of what I would call acute memory recall, much more than dopamine does. So we want to look at the entire pathway. Now, luckily, dopamine converts to norepinephrine in the majority of people, but that gene called the dopamine beta hydroxylase is weak in a whole lot of people too. So cognition is really about ensuring that our brain produces the neurotransmitters in an appropriate balance and ratio. So one thing that's really disappointing to me is that when you're dealing with neurotransmitters, people are always talking about quantity. Quantity really doesn't matter in my mind. What matters is the ratios of the neurotransmitters to each other. And what I mean by that is if I'm going to make a 1 pie versus 2 pies, I have a recipe, but the ratios are all the same whether I'm making 1 pie or 2 pies. Whereas people always want to look at raising one neurotransmitter, it's probably the weakness of medicines in general. Because medicines, the FDA wants it to be one thing that you're manipulating so that, you can get yourself approved and you know what you're doing, but that creates another problem that's kind of ridiculous. So in methylation, for instance, methylfolate is responsible for the production of both dopamine and serotonin. So what that means to me is that the way the Lord designed it is he always wanted dopamine and serotonin to be the same for us. He didn't want serotonin to be high with an SSRI and our dopamine way down here. That doesn't make a lot of sense. And so really from a standpoint of ensuring that cognition is there, you just need to focus on what's weak. How can we enhance it? Because almost all neurotransmitters have ways for us to enhance it or overcome it, with the exception of GABA. GABA tends to be a really hard thing from a medicinal and even from a supplementation standpoint to alter. The thing that's most effective for GABA modulation, which is the calming effect of the brain, is actually bioidentical progesterone in women. That's a very big modulator of GABA. And so what we're forced to do in most situations, because we can't alter GABA, is we have to go and block glutamate, which is where GABA comes from. So glutamate's a stimulant, GABA is a calming agent, and GABA actually comes from glutamate by the glutamic acid decarboxylase. So most of the time we're using things like magnesium, zinc. We have some supplements that block GABAergic receptors very nice, cavalactones, apigen, amantadine, which is a old prescription that's made from star anise, works very well. So in general, getting the balance back to the system seems to be the best at preserving the cognitive potential for everybody. Now, the second thing is you got to have inflammation control. And you and I at 62, we know that our inflammation tends to not resolve as quickly as it was when we were young men. So, the way I typically approach it is making sure that I have all the balance of the neurotransmitters in place. And cognitively, people will be very typically happy with that. I make sure the mitochondria is functioning well. We do most cognitive depletions that are early, meaning not classic ages, let's say 50s or 60s. A lot of times we'll find chemical toxins are involved, meaning we'll have to give some IVs of glutathione and decrease the toxin load, and don't even get me started on the foods and the environmental chemical load that we're having to deal with these days. So overall, and then making sure that glucose delivery, that what's become very apparent is we are underestimating insulin resistance. And by the time the A1C goes up, it's probably been around for 10 or 15, maybe 20 years. So making sure we have enough glucose delivery to make enough energy is a huge player in cognitive decline.
So it almost seems like if we can get everything in the proper balance and mitigate inflammation, and everything's going to be able to function well enough on its own to not have a lot of these issues that we talk about regarding aging.
Absolutely. And I don't think there's any doubt about that. And, and lifestyle plays a big role in it. And I had there's a friend of mine at church, and he's been a martial arts instructor for about 50 years. Still really in good shape. He's about my age. And I made the mistake of telling him I'm just having some trouble being motivated to do as much exercise as he used to. And he just looked at me and looked very serious and said, discipline is way better than motivation. And so that is the hardest part about lifestyle alterations, being very disciplined at it. You don't have to be ridiculous, but you just got to make sure that you put the time in for yourself, or your body's going to suffer.
And it seems like our approach anymore is to go after the quick fixes rather than having that discipline or, doing the things that we need to do. We're after the quick fixes. And so what's your take on the surge of interest in biohacking and a lot of these like cognitive enhancers that you're hearing people wanting to take? Are there safer, more evidence-based paths that you would recommend?
Well, absolutely. The biggest disappointment in me and in my observation of what's going on in the biohacking world is they get a lot of the chemistry really wrong. I'm sorry, but being a chemist and cell biologist, even guys who are immensely popular, just about half the stuff they say is just wrong. And so I don't want to name names or anything like that, but it does frustrate me. So also the other thing too is that we never look at one or two or three genes. We look at the entire pathway or all the associated genes. And if you don't look at the entire picture, you're going to wind up coming to the wrong conclusions. And the hardest part about biohacking and supplementation, so I'm kind of what we would call a tertiary referral source. I've lectured a lot. I mean, many tens of thousands of doctors I've lectured to. So if somebody can't get fixed, they're like, send them to Kendal, let him have a chance. And what I find out is a lot of times they come with genetics, and the doctor actually did everything right, but didn't get the timing right. Because sometimes, like, you can't put methylfolate in when there's a lot of inflammation because it feeds the immune system too. And if it's running hot, you're just going to make it run hotter, and you're going to make that patient feel worse. And so the hardest part about doing functional medicine at the objective level is knowing what information to get, not overspending. I don't want to get $5,000 worth of lab tests. You will never come back to see me. Do you understand? Mm-hmm. Targeting your approach, and then making sure you handle all the specific areas that really need to be addressed in the right order. It's kind of like cooking. So always remember that biochemistry works in recipes. It doesn't work in individual supplements. So I think of it as sugar. I mean, think of how many things I can make with sugar, but what can I make with sugar alone? So
diabetes.
I don't. Yeah, very, very good. But overall, what I'm trying to do is kind of make an analogy, and I use a lot of analogies because you and I both know a lot of people don't speak chemistry and cell biology very well. I mean, those are things we love. We study academically. I mean, we geek out on it, and it's good stuff. But overall, we have to have some way to explain it to people in a practical manner.
So for someone who wants to start exploring their own genetic profile, what are the first practical steps?
So I'm actually opening a new company next month that if you don't mind me saying so.
Go ahead and plug it.
So
That's fine.
I've built two genetic companies that were really about getting genetic panels in a thorough form to doctors. And so what really was frustrating to me is that I'd have to educate the doctors. Sometimes the doctors knew the information. So I decided to open a new company called Helix Revolution. And it's basically small genetic panels that are maybe 10 or 12 SNPs or 10 or 12 genes. And basically, they look at things like mitochondrial energy and methylation. They look at detoxification. And I shot videos of education so people can get these direct to public. And then what we did, which is really important, you don't really care what your gene is, you care how to fix it. And so what I did is, and I've been doing this since 2007, I built the supplement that answers the individual need, because when you build supplements, the packaging is a lot of the expense. And so I'm the chemist. I know the ratios. So I put everything that belongs together in a single bottle, trying to lessen the number of bottles that you take. Because you and I both know, especially with men, we are not very compliant if it gets too complicated. And so I like to say I can't give men more than 4 or 5 things to do, or they won't do it. And so that company is about small genetic panels, direct to the public, and then being able to have a supplement and only need what you need. And it'll tell us what we need and what we don't need, so you're not just left there guessing. So I would say if you have a very good functional doctor, get a very good genetic test. So I'm the medical director for Fagron, which is my company got bought by a big Belgian corporation called Fagron. So you can go to Fagron and get all kinds of tests. We have tests on athletic enhancement. We have tests on what's the perfect diet for you. We have tests on just about anything you can think of that's genetically doable these days, with the purpose of giving you the treatment, meaning what do you need to take, okay, to overcome the problem. And so that's the way I would proceed. So it's all dependent on what you have available to you.
So, what kind of data markers or information is most actionable for improving health span rather than just lifespan, if we're going to make that a goal?
Well, I can tell you that what we've been talking about, I've really been talking about health span, not lifespan.
Mm-hmm.
Quality of life is everything to people, especially neurocognitive. So my specific focus being on neuro-immune and neurocognitive decline. Nobody wants to be a burden to their family, and so I like to say that proper lifestyle, but that proper lifestyle has to have a caveat that we have a system that is fully primed to be compliant and to be able to give us the outcome we're really looking for. And so for me, the way we progress through this process is, if you really wanted to be thorough, you would look at a genetic that tells us about the system you're most worried about, whether it's immunologic, whether it's neurologic, whether it's a combination. I would then look at, you can certainly use a genetic to tell you exactly the best diet for your genetics, okay? Which is hard. Staying on a diet is not easy no matter what it is,
Mm-hmm.
and it doesn't mean you have to completely alter it and be obscene about it, but you have to stick to it. And then we also know that the proper exercise for you is appropriate. So for people who have been athletes, since kids like we have, we kind of know what exercise impacts us the most. But if people don't have any experience in that, we have another genetic test that looks at your genes and tells us which one's more appropriate for you. So you can answer all those questions without spending a ridiculous amount of money, but it's all about execution of the information once you get it.
So, if you could distill your decades of experience into one or two principles for aging well, what would they be?
Wow. Now you
Put you on the spot.
I'm a global guy. I don't know if I'm a one or two guy. Well, I mean, I think we've already covered it. I think that I certainly believe that dietary control, or not limitation, but not excess, and doing the right things is extremely important, very underestimated. Second thing is exercise for sure. With me saying that as you age, I really would move you into more a functional mobility type of work, as opposed to what you would think of as going to the gym and pounding it out or doing extra endurance. The third thing is identifying sources of inflammation that may be not apparent. I can tell you there are three things I underestimated as a young doctor. Number one, I underestimated dental health. Okay. So I do think seeing a good dentist that really recognizes that there can be a lot of problems and people don't really deal with it as a source of inflammation. I underestimated the power of the uterus on women, and when it's inflamed, how it can really affect them. And it's probably because I was a man and didn't really think about it the right way.
Yeah.
And then the third was chronic infections that tend to hide, like sinusitis or urinary tract infections or other things. So finding, or even inflammatory bowel issues or bowel irritation, getting rid of those is certainly part of the whole process, because if you don't limit that inflammation, it actually will be a whole body effect instead of just that one organ. And then lastly, obviously, I'm going to target genetics, so we give you a complete a complete picture. I like to think of a car that's going out of town. You will probably, if you're going to go on a long trip, you'll probably have your oil changed. You'll check the pressure on your tires. You'll fill your tank up, and then you head out. So that's kind of the way I like to approach longevity too. But we've got to know what to do.
Makes sense. And speaking of what to do, what are you doing personally to age well?
I'm doing all those things. So luckily I've got a wife who cares a lot about me, so she makes sure I eat right. I do more of I don't want to I would call it carnivore plus. I do exercise quite a lot, meaning 3 hours with a trainer every week, mostly on mobility, strength. I just had my right knee replaced, which has healed really well. I'm planning on snow skiing again, so
Nice.
that was the purpose of that. I wanted to stay active. I did it early just to be proactive. So I eat well, I exercise. I certainly know my genetics and do all that. So I'm doing everything I know how to do. Now I cheat a little bit. So I do some vitamin C and glutathione IVs because my glutathione system is genetically weak, which washes out chemicals and provides inflammation. And after my knee replacement, I did 2 rounds of exosomes which are stem cell derivatives in an IV fashion to actually help it heal appropriately. So, and then we also, one thing to mention, we are a lot of new research on therapeutic plasma exchange, or essentially washing the blood and replacing the plasma, especially in Alzheimer's and dementias. And so I have had a therapeutic plasma exchange because I perform it in the office and I'm always the first guinea pig for everything. So there are more aggressive ways to look at it, but all of those are monetary ways. We want to conserve money. We want to make sure we keep it within your budget. We don't want to be excessive, but we like to have objective indicators of any need. So we don't like to just guess and try to sell you a bunch of stuff.
Sounds kind of like, servicing your vehicle regularly. It's going to cost you some
Absolutely.
money, but in the long run, it's going to save you money.
I don't think there's any doubt about it. And so really it's just having a good practitioner that really understands it. And so just so your audience understands, there's really 2 forms of functional medicine, and there are actually differences in functional training. So there's one group, which is what I've been a professor for, called the A4M, the World Anti-Aging Congress. That's really most MDs, and it's really focused on understanding the chemistry and not as aggressive of blood work. The other one, which is called the IFM, nothing against them, but they tend to teach a whole lot of diagnostic testing and spending a lot of money. I like to think of it as throwing spaghetti against the wall and seeing what sticks. I think you want to find one that really focuses their effort, basically based on y'all's close communication instead of just doing a standard workup for everybody. So that's my only caveat, because the problem is these types of diagnostics a lot of times aren't covered by insurance, and they can be, some of them can be expensive. So,
So, how can people learn more about your work or your podcast, Coffee with Dr. Stewart?
yeah, well, just go to Coffee with Dr. Stewart. My daughter, who is in her final year at college and is going to be a PA, is my host, and she's a sharp cookie. And so we discuss what I like to think of are important things, mostly new things. We do cover some of that, but we cover new things just to get more information out. And it's kind of like your podcast. We just sit around and have coffee and talk, and whatever comes up, comes up. And so I would encourage them to go there and kind of listen, because you'll get an idea of what we're up to. And so
Absolutely.
also through Helix Revolution, that new direct to public genetic company, we're going to have ebooks. We'll have all kinds of videos on not just the genetic panels, but what the supplements are, why they're built the way they are. I mean, the whole key to all of genetics and all health, in my mind, is making sure that the public is educated on it, because they hear so much information, they're just overloaded. You don't want to get it from reels on on Instagram. You want to make sure it's focused and directed towards you.
So is there a link to a website for your new company?
Yes, helixrevolution.com.
Okay. I think you said that earlier, but just to kind of underscore that
Yeah, that's
here.
all right. No, that's just,
Yeah.
I mean, that's another one. And then extending me is, I'm the medical director. My job is to figure out how to fix some of these genetic alterations. But it's not my company, but I'm the medical director. And that is one that's really addressed in a much more aggressive genetic approach. We're doing a lot of research. We're actually checking 1.2 million genes in every patient.
Oh, wow.
And then we have a couple of bioinformatic companies that are, one in the UK and one in India, that are taking all the new genetic findings coming out in the literature and putting them in their database. And so what we've designed is, if you pay a one-time fee, which is about $1,200, we will not only give you the upfront panels that we have for diet and exercise and all that, but we also, every quarter, we merge the databases. And if anything pops up on your genetics, you will be notified with any genetic alteration that we identify.
That's pretty cool. So is there anything we
Yeah,
failed to talk about today?
I don't think so. We covered a lot. I just hope I
No.
didn't talk too much. So,
No, you can never talk too much. I feel like having you on a lot longer, but I know you're busy. You got things to do, so we'll have to have you back. Yeah,
all
maybe,
right.
especially as this new company gets launched, we can kind of talk about some of the other stuff that you're doing. But this was fun. I've
Sure.
learned a lot. I'm sure our listeners and viewers have learned a lot. Just keep doing what you're doing. Keep aging well.
Yes, sir. I appreciate it. Thank you so much. You too.
Thank you for listening. Hope you benefited from today's podcast. And until next time, keep aging well.